So today's topic is kidney diseases. We'll just go through some most common kidney diseases, how it affects the body. Okay, what happens, what is the actual pathophysiology, means what wrong happens in a normal kidney that you get this disease. Okay. So these topics are not from textbook. This is just random topics on disease conditions based on various systems in the body. Okay, just to make you understand, especially those who are from a non-medical background or non-science background, for you to have an ease of understanding. Okay, to know the basic concepts of what is normal and what is abnormal in the body. Okay, what disease conditions actually do within the body, just to make you understand those areas of medicine. We do this small topics. It makes your understanding of a diet and nutrition classes more easier. Okay. So kidneys are vital organs that filter fluid and waste out of the blood. Okay, you cannot live without them. Diseases that lower your kidneys' ability to clean your blood can affect not only the kidneys, but it can harm other parts of your body too. For example, cardiovascular system. Always remember your cardiovascular system and your urinary system. Kidneys are a part of urinary system. They act as twins. Okay. If anything goes wrong with either of these system, the other one will also get affected. If you're suffering from any cardiovascular diseases, your kidneys will get affected. Your kidneys will have the load of it. Okay. If you are having any disease conditions of the urinary system, your cardiovascular system will get affected. Okay. There is no stopping in that. So these health conditions can cause chronic kidney disease and kidney failure as well. Okay. So nephron, nephron is a single cell. Okay. This is the nephron is a structural and functional unit of your kidney. Nephron is a structural and functional unit of your kidney. Most kidney diseases attack nephron, means most kidney diseases are afflicting the cell structure of your kidneys. Okay. Slowly, more and more cells will get affected. The entire tissue or a region of the kidney will get affected, and that's how you have kidney failure. Okay. This damage will leave kidneys unable to remove waste. So you can see here the renal artery that is coming in. Okay. This is the Bowman's capsule. You don't have to remember all of these names. Okay. You don't have to remember the parts, names of these parts. So artery is bringing the blood from the body into this capsule, okay, for filtration. Okay. And this and all the waste materials, all the waste and everything, all the waste materials will be filtered out from the Bowman's capsule. It will be collected in this yellow tubes. Okay. All the waste materials will be collected in this yellow tubes, and it will go and form the ureter, and it will form the urine. Okay. So blood will come here. It will get filtered out. All the waste material will go into the yellow tube, yellow colored part. Okay. And the entire yellow colored part also has capillaries and blood vessels. Why? Because while filtering out, okay, for example, calcium, magnesium, phosphorus, iron, okay, while filtering out all these minerals, your body will give signal to the kidney, don't take up a lot of calcium, give back some calcium. So not many calcium ions or magnesium ions or any electrolyte that the body requires will be sent back into the body through the veins. Okay. So it will be sent back into the body through the veins, and the veins will take the deoxygenated blood. It is deoxygenated blood, but that blood has electrolytes that the body can use. Okay. So this deoxygenated blood that will be taken up by the renal vein, and it will go back into the body. Okay. So this is how the kidneys or the nephrons function. Blood will come here, filter out the waste. Okay. What is not at all required, like urea, uric acid, not at all required, it will get collected in this yellow tubule. A lot many tubules of the cells will come together and form the ureters, and it will be filtered out through urine. It will go out of your body. But some minerals, your body will need it back. Okay, some minerals, your body will need it back and it will be sent back into the renal vein. So is it clear to all so far? Is it clear to all how the nephron functions? So these causes, okay, slowly, each and every cells, each and every nephron, okay, if any toxins will come and attack this nephron, if the nephrons are getting damaged, filtration will not be done. Your body will not get back some essential electrolytes that it requires, that has reached the kidneys, but the body requires it back. These electrolytes will not reach the body, okay? So a lot many genetic problems, injuries, or some medications can also damage your kidneys. Okay, these toxins can come from medicines as well. Some medicines, okay, some injury, physical injury, if you get stabbed at your kidney, okay, if the kidneys have get stabbed or kidneys have got a gunshot wound, or you underwent a road traffic accident and internal injuries have happened and your kidneys are afflicted, okay, these the nephrons will stop working. The affected area nephrons will stop working. Okay. In some genetic problems, like some autoimmune diseases, antibodies will go and attack the nephrons, your own immunity. Okay, like that, nephrons can get damaged. So you have a higher risk of kidney disease if you have diabetes, high blood pressure, or any closed family member, blood relative, okay, like father, mother, siblings, grandparents. Okay, if your next two blood relatives have some kidney diseases, there are high chances that you may also get the same. Okay. So CKD stands for chronic kidney disease. Chronic means it develops over time. It takes years for this kidney disease to develop. Okay. So CKD is when lasting damage to your kidney causes them to lose their ability to filter waste, okay, and fluid out of your blood. Okay, what are kidney doing? Kidneys are actually filtering your blood. Okay, kidneys are actually filtering the blood out of waste. So in chronic CKD, slowly year after year, okay, the kidneys will get damaged step by step, and finally they will lose their ability to filter waste and fluid out of your blood. So this waste, if it is not been filtered out of your body, it can build up within your body and harm your health. Okay. So this damage and your kidney function can get worse over time. And when your kidneys stop working completely, this is called kidney failure or end stage renal disease. Year after year, so many damages have been accumulated that now your kidneys cannot function at all. This is the end stage of renal disease. Now the person will require dialysis. There is no other way. Okay. So you can see here the different stages of CKD, chronic kidney disease. Stage 1, normal function. Stage 2, mild loss of function. Slowly, some losses are there. Stage 3, moderate loss. 4, severe loss. And finally, stage 5 is kidney failure. No longer this kidney is functioning. You can see the size of the kidney has also decreased, atrophy. This is called atrophy. Atrophy means when the size is decreasing, the function also goes away. Next, you have polycystic kidney disease. Poly means many, so many, more than one. Okay. Cyst means what? Cyst is a fluid-filled cavity. You can see here, this is one cyst. It's a hollow cavity, but there is some fluid inside it. Some fluid is there inside it. This is a cyst. Okay. So polycystic kidney means in the kidney, there is more than one cyst. Okay, you can see here the entire kidney surface has a lot of hollow areas filled with fluid. Okay, some fluid is filled inside it. Okay, so this is a polycystic kidney disease. It is genetic as well. It runs within family, and it causes cyst, that is growth filled with fluid, to form on your kidneys or sometimes on other organs as well. Even in polycystic ovarian disease, okay, the same kind of cyst will appear in your ovaries for females. Okay, so these cysts can also lower your kidney's ability to filter fluid and waste from your blood. Okay, because the area where the cyst has been formed, the nephrons will not function properly. Okay, the area around in the diameter of the cyst, okay, the nephrons will not function properly. Over time, polycystic kidney disease can cause kidney failure as well if not treated. There is no cure for PKD, but treatments can slow the growth of cyst. Okay. So this is a lifelong disease. You cannot treat. You cannot completely cure the patient out of it. Okay, but some treatments you can take up, which can slow down the growth of cyst because it can multiply rapidly. Then lupus nephritis. Lupus is again an autoimmune disease. Okay, very common also, like not that common, but most of the cases of lupus we have seen happening in Western countries, USA or not. Okay, do you know this famous singer, pop singer, Selena Gomez? Have you heard about her? Selena Gomez, she's a pop star. She also has the same autoimmune disease, lupus nephritis. Okay. So her own immune system, the antibodies in her own immune system is going and attacking her kidneys. Okay. And she also underwent a kidney transplant. Okay. So lupus, in short, it is called lupus as well. Lupus nephritis means lupus can attack, lupus is an autoimmune disease. During the autoimmune disease, if your immune system is attacking your nephrons, we call it lupus nephritis. Okay, these antibodies, your immune system can attack any organ in your body, but if specifically if it is attacking your kidneys, we call it as nephritis. Okay, lupus nephritis. Autoimmune disease means what? Your own immune system is attacking your healthy cells. Okay, so lupus can affect many parts of your body, but especially when kidneys are affected, it's nephritis. Next is glomerulonephritis. So far, is it clear to all? All the disease conditions, is it clear to all? Yeah. So glomerulonephritis. Glomerulus means what? You can see here in the nephrons anatomy I have shown you. This is the Bowman's capsule. You can see a yellow bow kind of a structure. This is the Bowman's capsule, and this is the glomeruli. Glomeruli. This is where a lot many blood capillaries. You can see it is entangled. One will be a renal artery coming inside. One will be a renal vein that is going out. Okay, one artery will come on inside. This is the capillary that is completely entangled, and one renal vein will be going out. Okay, what is capillary? Capillary is the merging point between arteries and vein. Okay, arteries carry oxygenated blood, veins carry deoxygenated blood. Okay, so where does the exchange takes place? The exchange takes place at the capillary level. Okay, so the capillaries in your kidneys majorly are present in the glomeruli. Okay, so when this part glomeruli of the kidney, okay, this is a cellular structure. This is so tiny. These are cellular structures. Okay, so if this glomeruli undergoes inflammation, okay, I have explained what is inflammation earlier. Okay, so when the glomeruli undergoes inflammation, you call it as glomerulonephritis. Itis means what? Inflammation. Itis. If there is itis behind any medical terminology, it means inflammation. Okay. So glomeruli has undergone inflammation. Okay. So your kidneys contain more than 1 million glomeruli. It's a cellular structure, okay, which are tiny filters that remove waste and fluid from your body. We have discussed that earlier. If anything damages your glomeruli, which is the glomerulonephritis, they cannot do the job well. What is the job? To filter out the waste and fluid. Okay, so that cannot be done. If there is an inflammation, remember I said you, if there is an inflammation, there will be redness, there will be pain, okay, there will be increase in temperature, loss of function, swelling. Okay, these are the 5 cardinal signs of inflammation. Loss of function is also a sign of inflammation. Okay, so loss of function of glomeruli means what? They will not be able to filter out the waste properly. Okay, so if not treated, if the treatment is not given at the right time, glomerulonephritis can lead to serious kidney problems, including kidney failure. Okay, and one major sign that if is this person suffering from glomerulonephritis is proteinuria and hematuria. What is proteinuria? Protein in urine, presence of protein in urine. What is hematuria? Presence of blood in urine. Okay, so if you have these two symptoms, there is a protein in urine and blood in urine, you can do a urine sample test. Okay, give a urine sample test at laboratory, and if it comes out positive for proteinuria and hematuria, there are high chances that the patient may be suffering from glomerulonephritis. Okay, why? Because the Bowman's capsule glomeruli is not able to filter out the blood and the fluid waste properly. Okay, so protein can escape from the Bowman's capsule. Blood can also escape from the Bowman's capsule. Okay. Then IgA nephropathy. What is IgA? Anyone? IgA? Anyone from a medical background or science background? What would be the full form of Ig? At least Ig. Yes, it is immunoglobulin. Immunoglobulin. Okay, it's a protein. It's a protein structure that functions for your immunity. So IgA means immunoglobulin A. Okay, nephropathy, it's disease condition of your kidney, nephropathy. Again, IgA nephropathy is a rare disease condition that causes kidney damage when your own immune system, especially the IgA, immunoglobulin A, okay, it produces antibodies that can cause harmful inflammation in your kidney. Okay, IgA, that immunoglobulin antibody that is going to attack your kidneys. Okay, immunoglobulins are produced in your body against some specific infection. Okay, these antibodies will go and attack the kidney. This process lowers your kidney's ability to filter waste and fluid from your body. There is no cure for IgA, just like lupus. Okay, there is no cure for why. What is the difference between lupus and IgA? We know specifically this is an immunoglobulin antibody that is going and attacking the. It's an antibody that is going and attacking the nephrons. Okay, not any other parts of your immune system. Immune system has so many cells. Okay, immune system has many vast cells that can protect your body. But specifically when it is an immunoglobulin antibody that is going to attack the kidneys, we call it an IgA nephropathy. And treatments are used to suppress the immunity. Okay, what treatments are given here? Treatments that can calm down or suppress your immunity so that immunoglobulin A or immunoglobulin and antibodies can be suppressed. Okay, they are not that active. When they are not that active, they will not cause much damage. Next is diabetic kidney problems. So kidney damage from diabetes is called diabetic nephropathy. It begins long before you have symptoms. Okay, so even like those who are diabetic, it's said that every 6 months or at least once in a year, you have to do a complete abdominal and pelvic sonogram, okay, or sonography, just to be safe that There is no underlying disease conditions or inflammatory disease conditions that are beginning. Okay. So people with diabetes should get regular screenings for their kidneys. Tests we done in these screenings are urine test can be done to find out if there is a presence of protein or blood. Okay, blood test can be done to find out how well your kidneys are working. Okay, because if the kidneys are functioning normally, the electrolytes in your serum will be at the balanced rate. Okay, if the electrolytes are like completely shattered up and down, it means kidneys are not filtering out it well. Also, if there is a lot of urea or uric acid in your blood, it also triggers, it also points out to a kidney disease. Okay. So you can slow down the kidney damage or keep it from getting worse. Okay. Controlling your blood sugar, blood pressure, taking your medicines, okay, and not eating too much of protein can help. Okay. So those who have diagnosed, those patients who have been diagnosed with renal nephropathy or any nephropathies, only for them it is said they have to reduce the protein in their diet. Okay. So this is a normal, you can see here, this is a normal nephron. Okay, normal structure of glomerulus and Bowman's capsule and urine formation, how it filters out the waste and urine is formed. Okay, but here you can see protein along with some blood, RBCs can also leak into the Bowman's capsule and protein will be found in the urine as well. Okay. Kidney cancer. So far, is it clear to all the topics? Okay. Next, kidney cancer. The risk of kidney cancer increases as you age. Okay. Risk factors are smoking and having genetic conditions, or kidney cancer is common in your family. Misusing painkillers, overusing or misusing painkillers for a long period of time. Okay. And these are some of the risk factors or causes that can lead to kidney cancer. Symptoms: blood in your urine. Okay. There is a lump that you find in your abdomen, but the lump will be found in the later stage. Lump can be diagnosed just by touching or palpating. Just by touching or palpating, you will not find the lump until and unless it is a final stage of cancer. Okay, but when you do a ultrasonography, the lump can be seen in the sonogram, CT scan or sonogram. The lump can be seen, the size, how big it is, where it is positioned, okay, can be seen. Weight loss for no reason. Why weight loss? Because cancerous cell take up the nutrients and energy, okay, away from the healthy cells. Cancerous cells grow rapidly and they steal all the nutrients required for the maintenance of healthy cells, and they take all the nutrients for their own growth. Okay, so that causes energy deficit, and because of that, weight loss can be seen. Pain in the site that does not go away. Definitely, cancer is associated with pain. Wherever cancerous cells are formed, pain is associated. Loss of appetite. Loss of appetite can also lead to weight loss. Okay. So these are the symptoms of kidney cancer. Tests to diagnose kidney cancer include blood test, urine test, any imaging test. Imaging means you can do your sonography, CT, MRI. Okay. And you can also do a biopsy. If there is a tumor, take a biopsy. Biopsy can be done. A section of the tumor cells will be taken up. It will be studied in the lab to find out, is it benign or malignant? Benign means they are not spreading. They will stay as a lump in that particular area. But if it is malignant, means it is spreading. This can spread. It can spread from kidney to your intestine to your bones. Any part of the organ can get affected. Okay, this is how the cancer spreads, malignant cancer. Okay, so biopsy will be done in all cancers or tumors and cancers. Biopsy is done irrespective of how it looks like. Okay. So kidney cancer can also happen in different stages. You can see in stage 1 and stage 2, only kidneys are affected. But slowly in stage 3 and stage 4, the cancer cells have started to spread, okay, to the veins, to the vascular system. If the vascular system and the lymph nodes are getting affected, the entire body, any part of your body can get affected, because the blood vessels, the lymph vessels, they carry the cells from one point to another. Wherever these cells will go and settle down during the circulation, from there the cancer will start. Okay, is it clear to all? Kidney failure, harmful waste built up in your body, blood pressure increases, okay, body will retain a lot of fluid, not making, and the body is not even making enough blood cells. When the body has a lot of fluid, automatically your blood pressure will be high, because your blood vessels are dealing with a huge number of fluid. Okay, your blood vessels are not capable usually normally to deal with such a huge volume of blood and fluid. So automatically blood pressure will rise. Okay, the veins and arteries will have more pressure on their walls to get rid of this huge amount of fluid. Okay, so your body may retain excess fluid. So that's the reason why the people who have kidney failure, we do not give them sodium. We give them a sodium restricted diet. Okay, as sodium as little as possible, because sodium is able to retain more water in your body. Sodium will hold on to a lot of fluid in your body. Okay, so this is called kidney failure. Treatment options, you have dialysis or kidney transplant. If you have reached the stage of kidney failure, you only have two options: keep the dialysis going on, and by chance if you have a donor ready for transplantation, you can transplant. Okay, and if the transplantation works for you, not every transplantation is a successful case. Okay, that is just just half the way of your treatment. Transplantation surgery is just halfway. Okay, how long you can survive on a transplanted kidney, nobody can predict that. Okay, so if after transplantation also, after kidney transplantation also, uh, it is not working properly, or your immunity has started attacking the donor kidney, you will be put on dialysis again. Okay, kidney stones is a solid piece of material that forms in the kidney, not within in a day or two. It takes years for kidney stones to develop. Okay, it may be as small as a grain of sand, or it can be as large as a pearl. Okay, so the size of the stone completely depends on how long the kidney was not filtering it out properly. Most kidney stones pass out from the body without the help of doctor. Okay, if it is a tiny, it's a very tiny stone, the doctor will just advise you to drink more water, to have more fluid. Automatically it will be flushed out. The stone will be flushed out. But in some cases, stone will not go away properly. It may get stuck in your urinary tract. That is very painful. Okay, if a stone is getting stuck in your urinary tract, it is very painful. It can block your urine. It can cause a lot of pain as well. Okay, so stones come in different types. Calcium stone is the most common form of kidney stone. Uric acid stone is the next common type. Stewart stone, cystine stone. Okay, cystine stone is a protein stone. Calcium stone is also calcium based stone. Major component is calcium based. And then Stewart stone. So these are the four main types of stone depending on your diet, what kind of diet you are having. It depends. Whoever is getting dialysis, Okay, it depends at what age you are getting dialysis. Okay, if it is an autoimmune disease and from a very young age you are on dialysis, like for example 20s or 30s, okay, you can survive for 20 years more. 20 years you can go on dialysis and all. But if you are above the age of 70, you are a senior citizen, and then you are on dialysis, okay, the major time frame we can give you is maximum 3 to 4 years. Okay, maximum. So it depends at what age you're getting the dialysis done. Young adults can stay much longer. They can survive. They will have more years added up. But as you grow old, the survival rate, surviving on dialysis, falls down. Is it clear? Two white stone is usually caused by bacterial infections. It is an alkaline condition, alkaline stone. Uric acid stone is an acidic stone. Okay. So the following signs can be done, like the following signs of kidney stones. If you see in a patient, in a person, you have to ask them to seek a doctor's help. So if there is an extreme pain at your back or at the side of your body, that is not going away. Okay, and this is a colicky pain. We call it a colicky pain. Sudden, sharp pain that is spreading from the back region to the groin region. Colicky pain, sudden sharp pain, sudden, it happens very suddenly. It is not like a pain that is building up. Since morning you were slightly having some discomfort, by afternoon it increased in intensity. Not like that. Colicky pain is a sudden sharp pain. It will hit you like a spike. Okay, so that's sudden sharp pain. It starts from the back side. Okay, around your spine, side of your spine, and it spreads down immediately to your groin region. Okay, and this pain is not going away. That could be a sign of kidney stone. Blood in urine, because if a stone has got it has got stuck in your urinary tract or urethra, it can cause wear and tear in your urethra or ureters, and that could lead to bleeding, and that's how you will see blood in your urine. These stones, if they don't have a smooth surface, especially, they can cause tear in your ureters, or wherever they are stuck, they can cause tear there. Okay, and it will lead to bleeding, and that's how you will have blood in urine. Fever and chills, vomiting, urine that smells very bad or looks cloudy. Okay, and you have a burning feeling when you urinate. If you have these all signs and symptoms, it means the high chances that you may have a kidney stone. Next is kidney transplantation. Kidney transplantation is an operation that places healthy kidney in your body. The transplanted kidney takes over the work for two kidneys that have failed. Okay, so you no longer require dialysis. You can survive on one single kidney. Okay, often the new kidney will start making urine as soon as the blood start flowing through it. Okay, but it takes few weeks to start working. But as soon as the blood flow, a healthy normal blood flow has been achieved, a transplanted kidney can start its job. Okay, if you have a transplant, you must take drugs for rest. Okay, and these drugs are immunosuppressant drugs. They suppress your immunity so that your own body's immune system is not identifying the transplanted kidney as an external threat, and they don't want to. They should not be attacking the new transplanted kidney. Okay, so if they started attacking again, it will take many weeks to recover from that autoimmune attack and start working properly. Okay. So usually a transplanted person will be kept in a positive pressure isolation room. Coming to specific kidney test. Any infection will have fever, chills, And if it is UTI, burning feel during urination is definitely seen in UTI as well. The only thing that can to confirm a diagnosis is do a urine test. You have to do a urine test. By doing a urine test, you will identify, is this burning feeling because of an infection or is it because of a kidney stone? Because in urine test, presence of particle of stones will be there. Okay, so with that you can determine is it just a UTI or is it a kidney stone? And also you have to do the sonography. Imaging will also be done. So GFR rate, glomerular filtration rate, this is one test, most common blood test to check for CKD. It tells how well your kidneys are functioning. What is the rate of your glomerular filter. Then creatine blood urine test to check the levels of creatine in your blood. If the creatine levels in your blood are too high, means the kidneys are not functioning properly. And then albumin urine test, presence of protein in urine. Albumin is protein. Okay, presence of protein in urine. Again, urine sample is given and all these tests are done by that. Imaging test like ultrasound that can give you images, pictures of your kidney from a 3D point of view. If there is a tumor or a stone in your kidney, that can be identified with the size and shape of it, where it is positioned actually. Kidney biopsies can be done to determine what kind of cancer you're suffering from. Is it malignant tumor or benign tumor? Or what is the extent of the damage that your kidneys have gone through? That can also be identified using kidney biopsy. Coming to the steps that you can take to keep your kidneys healthy for a long period of time, choose foods which has less salt or sodium. So maximum fluid in your body can be used to flush out the toxins and electrolytes that is no longer required in your body, that can be flushed out. Okay, because if you have more sodium in your diet, the fluid that is supposed to exit your body will be retained back in your body. It will cause more harm. Control your blood pressure. Okay, as I mentioned, anything that goes wrong in your cardiovascular system will have some ill effects on your kidneys as well. Based on your lifestyle, your healthcare provider can tell you what should be a normal blood pressure for you. Check your blood sugar values. Okay, if you have diabetes, regularly check your blood sugar values. Be in the target range. Limit the amount of alcohol that you drink. Choose the foods that are healthy for your heart, like fruits, vegetables, whole grains, low-fat dairy food. Okay, keep your heart healthy, your kidneys will be happy. Lose weight if you are overweight. Be as physically active as possible. Quit smoking. So that's all about kidney diseases. If you have any queries, put it in the chat box.